Dr. Ben Smith is Métis from the Red River Valley and H.O. Dene from Fort Nelson First Nation. She has the honor and privilege of working as BC's Deputy Provincial Health Officer, Indigenous Health. She works alongside Dr. Bonnie Henry and other team members at the BC Office of the Provincial Health Officer to uphold the inherent rights of Indigenous peoples, unlearn and undo systematic white supremacy and racism, and advance true reconciliation. Kate is a white occupier living on the territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. She is an epidemiologist and mixed methods health researcher with over 15 years of experience documenting and responding to the impacts of settler colonialism on health and wellness. Recently, she completed a 2-year CIHR Health Systems Impact postdoctoral fellowship mentored by Dr. Danièle Ben Smith in the BC Office of the Provincial Health Officer. Now she is a senior scientist at the BC Centre for Disease Control, working to grow a Unlearning and Undoing White Supremacy and Indigenous Specific Racism lab. So this is the U&U lab for population and public health in BC. Two of her other roles are adjunct professor at the University of Victoria's School of Public Health and Social Policy and associate with Coco Consulting Ltd. Joining Dr. Ben Smith is Dr. Kate Jungbo today. So welcome to you both, and I will hand it off to you.
Awesome. Masicho, Marcy, Tancha Kiwao, Selotsiat Nezut Ne Kandeta, Danièle Ben Smith Dishnakashan, Sezitla Azezon, and Michifniash, Ten Michif, Pi Achodene At E, Fort Nelson First Nation, Gots Eate, Pi Winnipeg Dosjin, Anush Lakwangin Tanach, Lakwangin Tanach Niwikin, Pi Ni Minikwandilo de Tsałk Nation. Hello, it's so nice to be with you this morning. Thank you so much for that very inclusive biography. So I think this is all information that has already been shared. I just had a chance to share some of it in Michif and a teeny tiny bit of Slavey, my two languages. The two things that I just shared that weren't part of the biography is that I'm very grateful to be calling in from Lekwungen Tanach this morning. This is where I live and I'm raising my family on what's colonially referred to as Victoria. And I told you that the water that I'm drinking comes all the way from Skszwx Nation. So very pleased to be with you this morning, and I will pass it to Kate to introduce herself as well. Oh, sorry. And I'm cisgendered, straight, she, her. Thank you.
Good morning. Thank you so much for having me and for having Danièle. And I'm so excited. The previous speaker, hi, Carmen, your daughter, thanks for sending your daughter to work with us this summer. So we love that. And my name is Kate, as I shared. I'm a white lady. I'm an occupier on Musqueam territory. I'm here by the river. And whenever we get started, we always take a moment to acknowledge not just the lands and waters that we are calling in from, but also recognizing that First Nations territories stretch to every inch of the province that is known colonially as British Columbia, that First Nations have never ceded or surrendered their rights and title to these lands and waters, and they have those rights are rooted in connection to land and water. And also, lands and waters are the foundation of legal systems, health systems, education systems, governance systems that have existed here for thousands and thousands of years before settler law has arrived. And as a settler person, an occupier person, I have obligations to these inherent rights under international, national, and provincial law. And one of the ways that my workplace inadvertently upholds myths is that we sometimes only think of First Nations communities as these tiny postage stamps of reserves, but actually the territory is much wider and covers every inch of the province. And we also always recognize that there are lots of human beings here, First Nations, Inuit, and Métis people from homelands elsewhere in so-called Canada that carry with them inherent rights to health and well-being. And I've just got underneath here a couple of the different obligations that we have under international and national legal obligations to uphold those rights. And so a little bit about our work got introduced. Danielle, I can't remember who's doing what, so I'm just going. Okay. So, as was shared, I got to start working with Danièle in 2021. And at that time, I don't know if you've heard of this thing, it's COVID-19. It was impacting those, like everyone here in the province, but the people in the office of the Provincial Health Office were working hard to help us to stay healthy and well. And so they were working really hard and they were exhausted. And we also recognized that we had tremendous amount of work to do to, I was thinking about the last presentation, to get ready and like fix ourselves and do all the work we could do to get prepared to be absolutely the best partners with First Nations, Inuit, and Métis partners moving forward. And so we ended up starting to do this work of unlearning and undoing our own white supremacy and Indigenous specific racism. And we'll share a little bit about those experiences today. And we liked working together. We felt like the work we were doing was good. And so now we have expanded into what we're calling the UNU Lab. We recognize that so many of us are absolutely moved by our obligations to uphold inherent rights, eradicate Indigenous specific racism, and advance true reconciliation. But we were never taught how to do that during our graduate studies, or in fact, our society has told us how not to do that. And so we are really focused on the how of the work of eradicating Indigenous specific racism. And our research focuses on seeing patterns of white supremacy, building and testing evidence-based tools to eradicate Indigenous specific racism from every nook and cranny where it lives within research, within health systems, within society, and then asking, how are we going to know if what we're doing is working? And so this is a little bit about our work, and our website is here. And Danièle is like, Kate, you are not on our like usual script. So I'll just pause here. Danièle, do you want to go from here with? Okay,
Oh, you want me? Oh, yeah, switch over? Sure, we can do
sure.
that. Okay, awesome. So, thanks, Kate. No, I loved hearing you talk about that in that way, and bringing it back to how it all began. And so, truly, when we picked this work up in 2021. We knew that we needed to unlearn and undo racism and systemic white supremacy, but we didn't know how to do that. And so we looked to the brilliance of Dr. Kamara Jones and the science and practice of anti-racism framework that she developed, which gave us 3 core practices to name racism, ask how it's operating in our sphere of influence or in our office, and then organize and strategize to act. So we just got busy doing that. And one of the things that was really important to us was not to get stuck in a learning loop, but to orient ourselves to learn just enough to make a change and try and respond and act, and then continue in that circle loop. And then partway through Kate's fellowship, Puglas Jody Wilson-Raybould published her True Reconciliation book, and she named 3 core practices of learn, understand, and act. And we saw that as fitting really well with Dr. Kamara Jones's teachings. So those became the foundational steps that we continue 5 years on to just work our way around and around this circle. We also have been looking to the wisdom from the BC Ministers Advisory Council on Indigenous Women, who have created this Indigenous Gender-Based Analysis Plus Toolkit as another framework that we can use to try and address multiple other systems of oppression. And I think it might be on the next slide, or one that's forthcoming, where we talk about the 3 different lenses that we approach and have grounded our U&U work in, which is Indigenous specific racism, systemic white supremacy, and settler colonialism. But we know that those systems of oppression don't work or operate in isolation. They also interact with cis heteropatriarchy, with ableism. And so we want to be mindful of those intersections as well. And from a place of deep, deep humility, I will say that this is the framework that I still have so much homework to do to build my muscles in terms of layering that over our work. And then the next slide is it's this slide, which is also wonderful. So through this work, we came to an epiphany that I have found so helpful. For a really long time, I did not like the language of Indigenous health, which is quite awkward because it's in my job title. And I couldn't quite figure out why I would kind of bristle at that term. And in conversations with Kate and other colleagues, what I realized, or what we realized together, is that Indigenous health is a bit of a catch-all term that conflates distinct buckets of work that actually are different and need to be carried out by different people. And by using the term Indigenous health, we actually create harm. And so I'll talk about that in a minute, but let me describe the buckets of work first. So we have a birch bark basket from Treaty 8 territory where I'm from that we used as a symbol of the work that we have as First Nations, Inuit, and Métis. And that is the work of intergenerational healing, recovering from attempted genocide. It's the work of keeping our languages alive, keeping our ceremonies going, and just being who we are, which is difficult in a settler colonial state. So it's hard, heavy heart work. On the other side of the slide, we have a copper pot that comes from Kate's great Opa's machine shop in Holland. It's there right next to her in her office. And this is equally important work, and it's the work that must be carried out. The heavy lifting must be done by settlers, and it's the work of dismantling the systems of systemic white supremacy and Indigenous specific racism that have been put in place by settler colonial structures and policies and practices. This work needs to be done with guidance from First Nations, Métis, and Inuit, but the heavy lifting of this copper pot work must be on the shoulders of settlers. So the disservice and the harm that happens when we just put all this work together and we call it Indigenous health is that it usually gets tagged on to one person or one very small team that kind of dangle off the edge of an org chart. And then periodically an organization might turn to that one person or small team and say, oh, have you fixed our racism yet? No, okay, well, get back to it. Meanwhile, allowing the bulk of that organization to just carry on with the status quo, which is inherently quite harmful. So this has been quite helpful to us because it gives settlers a really clear entry point to the work. It makes it really clear whose work is what, and makes it also clear that both of these sides and buckets of work need to be resourced intensively in order to allow us to move forward and advance true reconciliation. So very quickly, what we are working towards is creating these Indigenous specific racism and white supremacy goggles or glasses that help us to see the ways that these show up, because they can be kind of insidious, and then holding up the mirror to ourselves. So we really make sure that we're very clear that we're not here as general experts on this. We're experts on how these things show up in our day-to-day lives, in the way that we carry out our work. And we share what we know on the off chance that it will be helpful to others. And then, as I mentioned, earlier, we have an action orientation. So as soon as we see white supremacy or Indigenous specific racism, we immediately want to put on our reconciliation gloves and get busy addressing it. And I think next Kate will talk a little bit more about another metaphor we have to understand. No, I'm going to do one more slide. So I am part of a parenting cult. My parents, my kids say, I follow Dr. Becky Kennedy and her Good Inside community, and I find so many of her teachings so helpful, including this one. This work is inherently and by design very uncomfortable because we're trying to shake things up and disrupt the status quo. And so it can be really helpful to us as we embark on this work to know that discomfort is a sign that we're doing something new, not that we're doing something wrong. So we actually hope that maybe some of the language, some of what we're talking today creates a bit of that ick feeling or discomfort feeling, because that actually means that we're laying down new neural pathways, and that's a really important step in this work. Now I think I'm passing it to Kate.
Yeah, so this is what Danielle was sharing earlier. We understand that there's multiple systems of oppression that are operating in our society, and Stephanie Nixon describes them each as a coin. And so we have a stack of coins here that highlight which systems of oppression that we are really focused on in our specific work. And that's not to say the other coins aren't important. This is just where our experience and insight is. And so, what Stephanie Nixon invites us to do is recognize that, like for me, especially in public health, I've always been like, oh, like people who experience disadvantage, marginalized people, vulnerable people, I want to spend my career helping them. But this actually shifts the framing, and it says that you don't have a person who has unearned disadvantage without some sort of parallel and related unearned advantage or privilege. And so, as a human being, I am a person who has unearned advantage related to settler colonialism. And there are people who are subject to settler colonialism and have unearned disadvantage resulting from it. And so the goal is not to like yank those people to the top of the coin, but rather our task is to dismantle the coin that creates these two different outcomes, one of harm and one of benefit. And so I think that really highlights for me, it's not like the people on the top are bad and the people on the bottom are good, but rather the problem is the system of oppression that remains intact. And so we talk a lot about these three systems of oppression, and we're going to spend a bit of time just talking about what we mean by those three words, because they're big words and a bit abstract. So, this is a metaphor that we use a lot, and you've probably realized by now we love a metaphor. So, in 2014, near my home in on Coast Salish territory, there was at Canada Place this huge art installation by Janet Echelman. It was a net and it was suspended over the water and the waterfront. There was 860,000 individual knots and it weighed over 3,500 pounds. And Janet Echelman, the artist, gave us permission to share it in this way with this metaphor, even though that's not the purpose of it from the start. But in this imagining, I think about those main lines that are holding this net of settler colonialism in place as those major structures like the reserve system, the Indian Act, the residential school system. So those are the main lines. But settler colonialism is also created and maintained in much finer detail by those individual knots. So maybe that's like a policy in your organization or a project charter that's governing or a research proposal, that kind of thing. And it shapes settler colonialism in much finer detail. And this was an aha moment for me because as an individual Canadian, I have some influence, but very little control over those big ones. But likely, just based on my work in the health system, I have around me some influence and maybe even control on those individual knots that make up settler colonialism in much finer detail. And so, in this metaphor, we've created this net, and First Nations people here in BC are caught in this net, strung up and prevented from living those land and water-based legal systems, health systems, impeded from that fully expressed version of their rights and title. And so, as I would go by this in 2014, walking around in that area, I was really struck by the fact that it looked so different during the day than at night. And so, we know that settler colonial laws and systems are, in effect, an apartheid system here. Danièle is subject to the Indian Act. She's made a ward of the state. And I am not subject to this. Despite her like brilliance and excellence and capacity, the Canadian law says that I am more able to perform as a human being, which is absurd. So as a settler, I am not trapped in this net. And from my vantage point on the seawall, maybe in one of the hotels or one of the like executive suites nearby, um, the nature of the net means that I only glimpse it sometimes. Often it's really nearly invisible. Like you can see in this daytime picture, there was just this one little bit lit up. Like maybe I'm aware that the residential school system was a problem. But then sometimes, like this night picture, for example, when the news broke about the 215 graves at Kamloops or on Orange Shirt Day, it momentarily becomes so visible. It's in your face. I'm in the healing professions. I'm like, this is important to me. What can I do? Um, that what can I do really, really comes up, but then the news cycle passes, like the urgency of who knows what else that's on my desk takes over again, and I put down that what I can do until it happens again. And so the lesson that I take from this is that one of my responsibilities, like as Danièle was saying about the glasses and the mirror and the gloves, is to keep my eye on the net, even when I'm asked to look away from it, or it's like white supremacy does its work to render it invisible. And so I want to share this one final photo from this art installation, and this is a part of the story too. One of the things that struck me as I looked at this was it's not Janet Echelman, the artist, up on this net. It's not Sir Duncan Campbell Scott. It's not Sir John A. Macdonald. I'm like questioning whether I should use their honorifics in this moment. Um, but actually, it's a few people who have special skills in net installation, regular Canadians just doing their jobs. And so this is the reminder for me that, like, unless I'm actively working to dismantle the net, I might be inadvertently, through just doing my job, keeping it in place. And so a couple of other things I noticed about this image. One, like we're on Musqueam, Tsleil-Waututh, and Squamish Coast Salish territory there, but the two flags that you see are the Canadian flag and the British flag, just emphasizing Canada's assertion of dominion over that place. And even if you were there at noon, you would hear Canada Place blast the first four notes of O Canada, again asserting dominion over this place. And so the artist, they didn't set out with this intention to provide this metaphor, but I think for me, they inadvertently like showed me a path forward. First Nations, Inuit, and Métis people across Canada have resisted the installation of this net at every turn, in every decade, in brilliant and difficult ways. And so we don't have like a tight weave. We have a net and we've created a really precarious system. And so cutting all the main lines at once is not what we've been guided to do, but rather in this metaphor, what I understand the work to be is for each of us, settlers and Indigenous people, to be able to see the net and understand which knots are within our sphere of control and our sphere of influence, and work every day in every way to untie those knots with guidance from First Nations, Inuit, and Métis people. It's hard work, it requires a ton of patience, and it needs a ton of persistence. And I'll pass it to Danièle for sharing this other vocab lesson.
Yes, and just as people can soak in this image, and I'll just say too that the work is not easy. So we're not presenting anything today with, again, in any way suggesting that we're experts or that, that this is, easy work. It's not. It's full of missteps. It's full of tears. So it is hard. And so we do wrap each other and everybody that's engaging in the work, or just even hearing about it, in a lot of love and care, because it can be very tough work. So this language in particular, white supremacy, we know evokes all kinds of feelings for people. And so we wanted to be really clear about what it is that we mean when we use this language. And we find this painting from Kent Monkman, who's a Cree artist, as a really good way to illustrate that. So this version of the painting is called The Daddies, and it's a recreation of a Robert Harris painting called The Fathers of Confederation. And the original painting was commissioned by Ottawa to celebrate the Charlottetown Conference, which was one of 3 conferences that led to the Confederacy of Canada. And as I understand it, when Kent Monkman saw the original painting, what caught his attention was an empty footstool in the foreground. And he took that as an opportunity to occupy the space with his alter ego, Mischief Eagle Testicle. And what he's really doing is drawing attention to the fact that Indigenous peoples were deliberately excluded from that pivotal moment in Canadian history. And we were excluded because of the widely held belief at the time of white supremacy, the belief that white European settler men in particular were superior to all others, including Indigenous peoples who were not even regarded as peoples at that time. And so what's interesting about that is if we fast forward to 2026, I believe that the vast majority of Canadians reject the idea of white supremacy. They reject that ideology. They reject the idea that there's something inherent in white people that makes them superior to other people. And we certainly have lots of Western science to debunk that myth or theory. The problem or the tension lies in the fact that despite the fact that the vast majority of Canadians reject that ideology, it is so deeply woven into and insidiously woven into our systems, structures, policies, and practices that it continues to confer unearned advantage on a narrow segment of the population and unearned disadvantage on the rest of us. And we see that in every outcome that we choose to look at, including the outcome of leadership. So when we look at this, these little emoji faces, I mean, it's really plain to see that there is an enduring impact of white supremacy and leadership. And so we're left with trying to reconcile this tension because on the one hand, I think the vast majority of us believe and know that there's nothing inherent in white folks or particularly white men that makes them better suited to leadership positions. And yet we see that kind of persist in our different leadership roles. And so it's important to pause here too, because we know that even these visualizations can lead some folks to feel quite defensive or feel as though we're attacking white men as an example. But what we're really trying to say is the problem is not white men, it's systems of white supremacy and cis heteropatriarchy that are the background operating system that are kind of always there and that we really need to work hard to pay attention to and be able to see. The next slide is another version of looking at that outcome. And so this is a slide or a graph that comes from the First Nations Population Health and Wellness Agenda. And what is really clear to see on this slide is life expectancy at birth. And there's a big difference between other residents and status First Nations people in BC. And so the reason for bringing this graph forward is not to reiterate that that disparity exists. That's something that's widely known. So actually the first reason we're bringing this forward is the fact that we have been so deeply socialized, even though as a core value we reject racism, we reject white supremacy. At the very same time, if I asked anybody in this webinar today to take a guess which line belonged to which group, I am quite certain that everybody would score A+ because we have been so deeply socialized to know that Indigenous people have a lower life expectancy, that we are more sick, etc. You could, again, add any kind of determinant of health there. So the second reason we're showing this is because I've just done something so harmful in the way that I made that statement. Status First Nations have a lower life expectancy than other residents of BC. What I've done is I've conflated risk with our identity. And to be 100% clear, being First Nations, Métis, or Inuit, that is a source of strength and resilience. Who we are as Dene, Michif, Anishinaabe, any one of our nations, who we are is what gives us strength and resilience, our language, our ceremony, our culture. What is very bad for our health is being subject to settler colonialism. So that's really what this graph is showing us. But we have been socialized and trained, and even through just our epidemiological rigor of the way that we make statements, to actually conflate risk with identity. So we have to decouple those. The third reason that we share this graph is because this is a graph with dots and numbers, but actually every single one of these numbers and dots represents our relatives and our family and our kin. So in my family, between 2016 and 2023, we had 8 members of my family die between the ages of 18 and 64. So we are overrepresented here, and that really comes with intense heartache and grief and loss within our families. With that, I will turn it back to Kate. And I will time check us both that we have about 10 minutes before we go into Q&A.
Sounds good. The other thing that really stands out to me for this slide is it debunks the myth that settler colonialism is something in the past. The fact that there is a decrease in life expectancy, steeper for people who are subject to settler colonialism, tells me that it's still alive and well and busy with its work of annihilation. And so Danièle shared that our work has been, or that Camara Jones's second task is to ask, how is it operating here? And so I just wanted to share this little example because I think the work that Danièle and I are busy with is like deepening our understanding and deepening and deepening and deepening over time so that we can understand all the colonial knots that are operating within our sphere of influence. And so last year we did this piece of work that was trying to get a little bit more detailed about the relationship between public health and settler colonialism, Indigenous specific racism, and white supremacy. And in this time, we talked about how there's actually four elements. One is that epidemics are tools of settler colonialism. They have been used deliberately to clear the land. We also know that there's an embedded whiteness. Originally, there are some very clear examples of how public health was set up not for the health of all, but for the health of white people specifically. We also know that settler colonialism has created new health risks here. We know that absent settler behavior on these lands and territories, it's unlikely that we would be having these extreme weather events that are happening, the impacts of climate change that are impacting all of us. And then finally, this last bucket here is the potential of people working in public health and also in your sphere of influence to be champions, to be really vocal and active in the work to scrub out Indigenous specific racism as a determinant of health. And so this comes back to that copper pot work. And Danièle, we made a mistake, as we do all the time. The mistake we made was that we made a commitment to our Anishinaabe colleagues and relatives that we would never share the basket and copper pot metaphor without acknowledging this set of teachings that we generously were given by Phyllis Williams from Curve Lake First Nation, who's Anishinaabe. And she shared with us that in her territory and her governance and Anishinaabe legal systems, copper pots actually have a really, really important role to play in the health of water. And so she shared with us teachings that copper pots are actually sacred vessels. And like we know this in our Western worldview too, that copper has these amazing properties of healing and cleansing. So sorry, not healing, cleansing properties. And so that adds a layer of sacredness to our work and just acknowledging that for some people, copper pot is the work of their cultural protocols. And so I shared when I was sharing the net metaphor that so often the settler reaction when they hear about these things is, what can I do? And so I want to invite you to recognize that actually we have a huge amount of information and instructions at our fingertips that help us help guide the what can we do, and engagement with Indigenous people directly is one option, but it's not the only option. And if we don't have that option, there is still so much that we can do. So I think it's really important that we recognize that upholding inherent rights, eradicating Indigenous specific racism isn't like a nice to do, it's a legal obligation. Danièle and I aren't here because of our benevolence. We are here because of that really, really important obligation. And we have those obligations under the treaties, in our Constitution, under federal and provincial law now. We've also received a very clear framework. So the Truth and Reconciliation Commission said the UN Declaration on the Rights of Indigenous People is the framework for action. And we've received thousands of clear instructions. So the TRC has 94 calls to action. The MMIWG2S LGBTQIA+ has 231. And what I found for myself was that I had read these reports once and I was like, oh yeah, I'm probably changed. So no need to revisit those later. I'm probably doing anti-racist work now. But the truth is that we know behavior change is not so simple, that it's actually something that you really need to stay on top of. And so this forced me to go back to these reports, get really clear on which ones are relevant to my work. And what did they say? And am I doing that in a concerted, coherent, consistent way? And so that's really important. And the check marks here represent that all this work has been done by First Nations, Inuit, and Métis people. They've done all the heavy lifting for us. And so out of that, like respect and responsibility and obligations, we have responsibilities here in the action and implementation. And I would say too, all these different instructions, there's one that touches on every scope of work from like HR to transplant, like clinical to somebody, yeah, every different role and responsibility, there's instructions there for us. And so, Danielle,
Yeah,
I'm
we
going
can.
to pass it back to you.
Sounds good. We wanted to, even though we've got a condensed, and actually we haven't expanded, so I know our session is a little bit longer than the format, and for us it feels condensed just because we love our topic. It's quite rich, and there's so many foundational pieces to share. But we did want to make sure we could share at least one tool that you could take away and consider applying this afternoon or tomorrow in your work. And it basically emerged from an experience or a pattern that was happening in my role. I would get multiple requests from different places to review documents or policies or different things and provide Indigenous perspectives. And invariably, I would sort of get a bit of a heart sink feeling because the document would arrive and it would be really clear that that conflation thing, that all of the work and heavy lifting was left on my shoulders, that the authors of the particular document, beyond kind of having that light bulb of, oh, we should maybe include Indigenous perspectives, had not done any other homework or reflection or attempt to name their copper pot obligations, as Kate just kind of described in the previous slide. So we developed what we call a colonial not review, or also a Control F protocol. And so this is something you can do today. You could do it actually right now while I'm speaking. In fact, if you've got a tab open, you can go into a document and just search these different terms. So just Control F and see where they show up in a document or not. And what we've found in using this protocol now for several years is that there's a few patterns that are very common in documents that we are asked to review and in documents that we develop. So again, so much of this happens in a rote way, in a status quo way, in a like just doing the way that we've always done them. So, Kate, if you move to the next slide, the patterns that are very common and you might see in your own documents or reviewing other documents, the first one is just total erasure and invisibilization. So First Nations rights and title or Indigenous rights are just not mentioned at all. Sometimes the problem's mislabeled, which I talked about before. Sometimes things are framed in a paternalistic or stereotyped way. So we're framed as being marginalized or vulnerable without that context of why we've been made vulnerable through systematic, deliberate, and intentional policy choices. Colonial scripts get upheld. So sometimes there's kind of like quite a strong start and acknowledgement of Indigenous rights is made, but then that thread and that rights-based lens and framing is not carried through the rest of the document. So everything else is status quo. Pan-indigenization is something that happens quite frequently, and we have had to work really hard to build our muscles to not do that, but rather be respectful of individual nations, of Métis Nation, and we're just starting to do that work with Inuit living in BC. And then one of the last patterns that we see happen is a blanket application of EDI, where Indigenous rights holders become conflated with equity-seeking making groups. And that sort of ties back to that first pattern of erasing and invisibilizing the very unique and distinct relationship that we have as original inhabitants with the Crown, which set up a totally unique and specific set of obligations and relationships and responsibilities. I know that we're kind of like moving into the Q&A portion. And yes, Tamara, these two slides are actually on our website. So we can even like just give you the link to the tab where you'll find these two specific slides. And so we'll move into our closing section. And the first thing that we want to share are some words that come from the late Senator Murray Sinclair, Justice Sinclair. And these are they were reprinted in Jody Wilson-Raybould's book. And so what Senator Sinclair said is that one of the things I make sure non-Indigenous people understand is we don't need you to help heal us. We need you to fix yourselves. We need you to get those people out there who are perpetrating this process of working against reconciliation under control. We need you to straighten yourselves out. We don't need you to just step forward and say, well, here's what we can do for you. Because my question is always, what are you doing for yourself? What are you doing to get rid of that violent vocal force that's holding us all back, holding this country back? Because that's what's going to stop reconciliation. So we have 3 prompts or questions that we use in our work that are framed along those Learn, Understand, Act. So again, please feel free to take these away for yourself or with your teams to consider, what homework have I and my team done, and what homework am I continuing to do to learn from the original inhabitants of the lands and waters about their laws and teachings, as well as the truths of settler colonial harms and how they continue to manifest in the present day. What homework have I and my team done or are continuing to do to understand those foundational obligations that we hold that are yet unmet? And then how have I and my team begun to act in ways that challenge, elevate, and advance true reconciliation, including hardwiring accountability and marathon actions towards meeting those foundational obligations? And Jody Wilson-Raybould gives us 2 really helpful prompts to kind of check ourselves in that ACT bucket of work. She asks, are the actions that we're taking, do they require courage, and do they lead to uncomfortable change? Those are 2 great temperature checks to kind of see whether or not we're kind of in the right realm of action taking. And so we are inviting you guys to join us at the Fix Ourselves gym. So we have been working to build our strength through discipline and stamina. So in the same way that you might start a new workout program, we all know that we're not going to get results just by signing membership to a gym. We actually have to show up. We have to show up on days when life is busy and we've got multiple demands on our time. We need to show up in those moments. We need to show up when our muscles are sore and battered and bruised from the workout the day before. We still have to show up the next day. And it's through this conscious, coherent, and consistent attention and effort that we actually build these muscles of anti-racism and build our ability to kind of walk this bumpy road of reconciliation. So with that, I'll stop and maybe just check in with Kate to see if there's any last things. No, Kate's giving me the thumbs up. So I will pause there and just say Masi Cho, Marci, Ekoshit to the organizers for inviting us to come and share. It was really our pleasure, and we are certainly happy to take any questions or hear your comments. Thanks.
Thank you so much, Drs. Ben Smith and John Blood, for such a powerful conversation. I know that just listening to you over this past hour, my perspective on understanding these two buckets of Indigenous health and unlearning, white supremacism has completely shifted. So I definitely have some questions I would love to ask you. But before I do that, I would love to invite our audience to ask any questions that you have. You can raise your hand. I see that Carmen has her hand raised. You can turn your mic on or leave it in the chat and I can read it out for you as well.
Thank you so much for this presentation. It's the second time I've heard it, and it's just so powerful, and it's just amazing, again, to keep relearning and recommitting to the work. So I just want to thank you for the shout out to my wonderful child. I'm very biased, but I'm so thankful she gets to mentor with two strong women, so appreciate that. And I really appreciate my question, sorry to everybody gathered here, but it might be specific to British Columbia, because I think British Columbia is really doing a good job leading in this work across Turtle Island. So I really appreciate the work that you're doing. And I'm thankful, Danièle, that you pointed out that being Indigenous is not a risk factor, right? It's indeed our strength and our resilience. And when I think about my own child, I believe that is what has sustained her in her health journey. That has really, really informed how her outcome has been so good. But having said that, I am curious if the work that you're doing is actually reaching people at BC Transplant or at the transplant clinics at BC Children's, at Vancouver General, at St. Paul's Hospital, because this work is amazing. But when I don't see it in practice in that transplant clinic. So when my adult child goes into clinic, the trauma-informed lens is not there as an Indigenous person who's facing a complex health journey. So I'm just curious, is this trickling down? Is there hope? Thank you.
Yes. Thank you, Marcy, Carmen. And I didn't mention in my introduction, but my two daughters are citizens of Métis Nation BC through me, but I'm not a citizen because I'm status through my dad. So there you have it. But Masi Cho, to all the work that you do as a leader for our nation here, because I know that that benefits my kids. So an opportunity to publicly shout out the good work that you do. Thank you, Marcy. Yeah, this is really the challenge before us, right? Is how do we get this orientation to the work happening in many different places and spaces? And so I'll say a couple of things. Like we really have set our sights in population and public health because that's where we're rooted. And so that's absolutely where the bulk of our effort has been. Kate moving over to BC CDC with the lab was kind of like stretching us into being closer to some of those kind of like provincial scope expansion of that. And we have just gotten a small grant from the Ministry of Health to work alongside their Indigenous specific anti-racism team. I think to answer a bit of the question that you're asking, which is there's a ton of work happening. We know that, right? Like there's so much work happening around cultural safety and humility training and rolling things out. And I think the big question, certainly we have in our own work is like, is what we're doing working? Like we have instructions, we have obligations, we have trainings, even in our own work, like we're taking actions and we really want to understand that bridging of like going from learning from and with First Nations, Métis, and Inuit, but also learning about our own whiteness, right? And our own systemic white supremacy in settler organizations. So the short answer is no. We've never like directly worked with any of the clinical transplant teams or shared, to my knowledge, shared any of like the work that we've done there. But we are connected at this other level to say, hey, how does, because the Ministry of Health is saying like, how do we know? How can we track that? How can we performance manage, right? Like we need to be able to be able, and we're using this gym metaphor. So we want to understand of all these different folks that are out there in this helping profession, out there to serve British Columbians. Like, are they are they signed up at the gym? How did they show up on the first day at their gym workout? Is the coaching that they've received, is it helping them kind of like develop the muscles that they need to do their work differently? So those are all questions that we're really interested in. And so, yeah, we're happy to kind of build networks, and like we understand that our scope is limited. So, but we want to be a part of kind of like leveraging and leveling up across the system. Kate, that was a wordy answer.
We're
My
also here
specialty, a
in
wordy answer.
service.
Yes.
We have like on our website, we have recordings of us sharing this presentation, and you can like prescribe it to other humans if you feel like it's useful, or like we're here in service. So if there's a place that's needs to talk about white supremacy, we can go there if we're invited.
Thank you very much, Carmen, Drs. Ben Smith, and John Gludd, for touching on that topic. I have another question for you, if it's all right. Again, if anyone has any questions, I invite you to turn your mic on or to leave it in the chat. But my question for you is that, many organizations and researchers are starting to become more comfortable talking about reconciliation, are, sort of going to the gym and trying to unlearn ideas from white supremacy or settler colonialism. But in your experience, what are some of the most difficult and persistent untrue assumptions, practices, or power structures which are still sort of holding on in the research and healthcare community?
You want to go first, Kate? Yeah, go for it.
What your question brings to mind for me is kind of when we put things in a binary of like I'm not a racist. And one of the teachers that we rely on so often is Ibram X. Kendi and his book, How to Be an Anti-Racist. And he's so like generous and humble in it. He's a Black man living in the United States, and he talks about how he has done racism like in his life. Like he's not immune from it just because of his own identity. And one of the things he shares is that racism isn't like a tattoo, it's a name tag. So in any given situation, I can show up and seek to operate in an anti-racist way, or I can either inadvertently or deliberately operate in a racist way. There is no neutral at this point in time. And so for me, that's been so helpful to not like bracket myself out and think, oh yeah, racism is something that other people are doing. It's bad, but it's about me and like how my deeply held values, as Danielle was talking about, are that the rights of Indigenous people are fully upheld and that there's no racism. And like my behavior and my beliefs, it's going to be a lifetime of work to get those into alignment. And sort of to Carmen's question too, like as a society, it's going to be like a long time, but not just time, it's going to be work, like a lot of work to bring sorry about that, to bring these things into alignment. So one of the things that I think can be the most powerful is just an acknowledgement to yourself that like I'm a racist. I'm a person who does racism sometimes. And like I'm going to swear, my first fucking choice is to never do racism. And so I'm going to work on that. I'm going to work on that every single day because there isn't something that makes me, even though I am sitting here with Danielle and she's put her like stamp of approval on me. I still do it. So it's a day-to-day work. That's what I would reflect on for that one.
Yeah, and you don't need to be perfect. Perfect is weird. And it really is about like you don't need to have all the solutions, even naming it in the moment, like, oh, I just upheld the tyranny of the majority, or ugh, this thing happened. Like that's really kind of first step because I think, and I see beautiful Veronica McKinney, so I'm waving and saying hello, and we'll let you guys wrap up and move on. But I think the greatest myth for me is that first pattern, like that erasure and invisibilization, and this assumed exhaustive jurisdiction of crown law and crown ways of doing things that just totally ignores the fact that we are still here. We still have our laws, we still have our ways of being, and we still have rights and jurisdiction. So that can't be ignored, but it is definitely part of the myth that endures. So yeah, so thank you so much again for having us. We're really grateful that we were able to share this time with you today.
Thank you so much, Drs. Ben Smith and John Blood, both for that answer and for such a thought-provoking presentation today.